So we all know that ACL injuries are very common knee ligament injuries, and it's an injury that happens to both young athletes and also older athletes. And while we've had very good surgeries for ACL injuries, we know that it's not successful for every individual that undergoes that surgery. So we've kind of taken more of a biological approach in terms of trying to figure out why certain individuals may be successful with surgery versus not. So there are various grafts that we could take from the patients to reconstruct their knee, and that includes hamstrings, quadriceps tendon, patella tendon. What we found is that even though at time zero these tissues are strong enough compared to the native ACL before it's torn, biologically they're actually different, and the behavior is different when you stress them in laboratory conditions. They make different inflammatory markers and also different collagen under mechanical stress. And so each one of these tissues actually probably has a unique signature. So depending on the individual and how fast the rehabilitation may need to occur, you may want to match that tissue and balance it based on the comorbidities that comes from taking that tissue. I think a lot of us, when we choose graft tissues, we're more likely to choose them because this is what we're trained on, this is what we're comfortable doing. And I think what's bearing out from the research is that we probably have to consider the individual that we're putting this in, consider their biology, consider how these grafts behave, and match that tissue to that person that we're treating.